My mother is also a breast cancer survivor, and she was diagnosed at the age of 58. So I, early on, at the age of 30, was starting to get my annual mammograms, and everything was going fine. And around the age of 42, I still thought everything was going fine. I was really getting involved in working out with a trainer, and I thought I had pulled my right pectoral muscle. And I was like, wow, maybe it's from doing too many push-ups. I thought, oh, I'm getting into shape and everything. And and then it started to really hurt and hurt some more. And wouldn't you know it, Murphy's Law, I was always going for my annual mammogram in December. Well, that particular year, I thought, oh, I'm just going to push it off. Maybe I'll do it into the spring. And then the right side, it started to hurt even more. And I noticed a lump, and it was starting to protrude out of my skin. And I thought, I need to go get in sooner versus later. I went for my mammogram, and I also did an ultrasound. Sure enough, they did a biopsy, and I got the news about a week later that I was diagnosed with stage 2 ductal carcinoma. So that's pretty much what happened to me, and talk about being a deer in the headlights. But fortunately, I had been going every year to get my mammogram and watching to see if there were any changes. And because of my family history, I knew that I could possibly be a candidate for something like this. And so when it happened, I didn't think it was going to ever happen at the age of 42, but it did. And thank goodness that I acted sooner versus later, because I was diagnosed at stage 2 versus 3 or 4, or God knows even worse. That's what happened to me.
Yeah, and I think it's important to really emphasize Lisa's stories here, and we're going to ask Kathy to also talk about the stories that she's heard. But clearly, this is the story I've heard before. Sometimes women working out. But here's what's so very, very important. It's not having the fear to touch your own body. And what's really important, I think, for all of us, and a big-time takeaway message from this Google Hangout is it's so important to know your own body. It's so important then if a symptom comes up to follow up on that. It's so important to not be afraid to follow up on it. Kathy, you and I, through our years of work in this field, have seen patient after patient who wants to jump into denial, Kathy, instead of saying, wait a minute, I got to follow through on this. Kathy Cole, do you want to add to that a little bit about Lisa's story and your perspective as well?
Lisa certainly has a very compelling story, and it just is so important to listen to her story that she was proactive, didn't put it off, went to see what she needed to do, and acted upon it. And Jay, you couldn't be more right. There's a lot of fear around this diagnosis, but we've come a long way, as you know. There's been so many changes both in medicine and surgery techniques and imaging techniques that make this so important for us to catch these things ourselves earlier at the proper time, and also that we're going to show a standardized approach so that you're exactly doing the same exam each month and have the confidence to know you haven't missed anything, so you can report any changes that you know to your healthcare provider.
I want to echo that very, very much. One thing, Lisa, though, about your story that is not typical, and that's pain.
Yes.
You pointed out that you had pain. And Kathy and I have seen lots and lots of patients who come in complaining of pain in their breast and then thinking, oh my gosh, this is breast cancer. In fact, frankly, it's not typical at all for breast cancer to present with pain. Now, in my line of work, I tell people I never say never, and I never say always. So, that was one of the important things that led to your diagnosis. So I don't want people out there over the hangout to be thinking, oh my gosh, if I've got pain, I've got to run down tomorrow and have it evaluated. But what I really want to emphasize is the proactive stance that you have.